I'm using Juvederm Voluma, 27 gauge needle, ultra thin wall. The first injection point is at the fusion line between the temporal bone and the zygomatic bone. I like to tap on the skin to distract the patient. I also like to tell the patient I'm going to inject, so needle going in, Jenny. And we inject just on the periosteum. And I normally deposit until I feel between my fingers the bolus. And one can clearly see the bolus on the screen. And with just some gentle pressure, we mold that and give it a shape. How would I feel?
That's fine.
Okay. Chin up. Alcohol. The next is the malar eminence. We want to recreate and improve the reflection of light that one can see on the actual cheek area. And again, I'm going to tap, needle going in, just above periosteum, and here again I deposit until I feel the product between my fingers producing a bit of bulging and pressure, and one can see a very nice improvement of that area. Not sore or sensitive so far?
No, it's fine.
Okay. And the last one, mostly to improve that indent. But what I'd like to do is actually stop, head forward. Do you notice how by injecting the first and the second injection points, how it's flattened and actually improved that indent, and the shadowing is not as obvious. So head bit down, we can see the difference between the right and the left. Chin up again a little bit. Alcohol. So this is my rule. Every time the needle goes through the skin, chin up with this. I like to use alcohol before entering with the needle. And again, needle going in. And here we are concerned that we might be close to vascular structures, so I'll wait till I see the bubble. Without moving the syringe, we then deposit 0.2 moles, and I immediately mold that towards the area that I would like slightly fuller. And what I also think is important with a young patient that's happy with their features is not to make the cheek augmentation overtly obvious. What I would like is that there is improvement and that she hardly notices that anything actually has been done. Just a final bit of alcohol. And I must be honest, we have been really lucky with our injecting so far, in the sense of no bleed back with each injection point, both me and Gerard. I was very impressed with that. And so far we've been lucky with our patient choice, but in reality, when we're injecting in our clinics, we definitely do hit vessels and there can be some bleeding. And the most important thing to do is, if there's bleeding, is just put some pressure until that stops, and that usually can take up to a minute. Okay, so let's move on to the chin area. Again, head, let's do it before, head up. So there's not a dramatic change, but there is definitely an improvement and a nice angulation to the actual jawline, and a slight improvement in that OG curve when we compare the two sides. Okay, head back. Just give me another little bit, please. Thank you. Moving on to the chin, we want to increase the lower third distance slightly, but we also want to forward project the actual chin. So those of you who attended the talk yesterday at the Allegan Symposium, that equates to the MD codes C2 and C4, chin as high as you can. And from an anatomical point, it's the apex of the chin as well as the pogonium of the chin that we're aiming for. And I just want to position my fingers and my hands so that we don't interrupt the camera's view. Midline, this is for C2. Needle going in. Right on the anterior aspect of the bone of the mandible. Here I'm depositing 0.2 moles. Then the inferior aspect, I can feel it at my thumb, We immediately mold and put pressure to give the chin the correct shape and also to ensure uniformity of the product. As a good guideline, the intercanthal distance should be equivalent to the interalar distance, which should also give us the distance or the width of the actual chin. Just want you to face me quickly. I'm very happy with that. Okay, so let's assess our results. Before I do that, I just want a facial wipe to wipe all the marks off that I've made. Sorry, the alcohol can burn the eyes. If you want to close them, I'll dry it in a sec. My apologies. Facial wipe. That's okay. That's okay. Step the thing forward. Let's take a closer look. Again, at the cheek area, for me, the most dramatic improvement is in that slight indent that she had in the malar region, and also that the chin has now is slightly elongated in the superior-inferior distance. But most importantly, let's have a look at the profile view. Turn a little more. And we can see, because of the improvement of the cheek, as well as an improvement in the forward projection of the chin, that concavity doesn't appear as much. And even to a certain degree, that indent in the nose has improved, purely because of the shape that we've recreated with the cheek as well as with the chin. Thank you. That was very good. You did